All right, everybody, welcome in. Boy, did we just have a crazy rain shower downtown. So if you are east of us, and you most likely are, it is a rolling in. So everybody, just careful, eyes to the sky. It's going to be a perfect morning to stay home because we have some really interesting information for you right now on our show. So sit back, grab a cup of coffee, and let's talk a little bit about what happened just a few weeks ago over at Millard Fillmore Gates Hospital. It was just a few weeks ago that our next guest worked on a handful of MS patients to test the efficacy and the safety of a minimally invasive procedure aimed to reduce their MS symptoms. Now, I'm going to introduce to you our doctors who were the principal doctors involved, Dr. Levy and, of course, Dr. Siddiqui from UB Neurosurgery. You're here to explain what you did because a lot of people really weren't sure. We heard on other channels it was a cure for MS. We heard a lot of things. I was so happy to be there with you watching. Let's talk about this study, which study it is, and what you did. And we do have some video from that day where we can actually show you what was going on. So good morning and welcome.
Thank you. Good morning.
Tell us a little bit. This is what they call the Italian study, right?
Yes.
Okay.
So the disease of MS has been associated with inflammation in the brain. The cause of that inflammation remains to date unknown. And this outside-the-box thinker, a vascular surgeon in Italy by the name of Paolo Zamboni, has suggested a new thinking about MS. It's not known whether he's correct or not. It's just a new hypothesis. And that is that blocked veins in the neck and chest may either aid or cause or worsen multiple sclerosis. That's his hypothesis. And that's why everybody has given him credit, and he has called it the liberation procedure.
Okay. So what you did, you've gotten permission to take step one of this, which was to test this hypothesis on a handful of patients over at Gates Circle.
Exactly. This is the first study, we believe, worldwide that's going to test the safety of this procedure. We believe this can potentially help patients, but we want to do this under the rigors of science in a controlled study. And first we have to understand, is this safe to do? And when we mean this, what is this? We're going to take special types of balloons and pop open these blockages. So the theory, as Dr. Siddiqui said, is that the veins that drain the brain are clogged, and the brain now can't drain the blood, and there's an inflammation that occurs, and depending on what part of the brain is affected, symptoms of speech problems, cognitive problems, inability to use your arm or leg or walk, all these symptoms that you hear from MS patients result potentially from the inflammation caused by blocked veins. So, as Dr. Siddiqui said, what we did is, under the rigors of a safety trial, took a handful of patients from US and Canada and popped open these blockages with special devices using the minimally invasive techniques that we've often talked about we use for stroke patients at the Stroke Center at Millard Fillmore Gates, and through some of the research we do at the Toshiba Stroke Research Center.
And the veins that you worked on were primarily in the jugular.
So the disease thus far, the way we understand it, the hypothesis is that these large veins that drain the large amount of brain and spinal cord are the ones that are affected. The jugular veins do the lion's share of drainage as far as the brain is concerned. And then there's this other large vein in the chest, which is called the azygos vein. So we primarily concentrated on these three veins, although we looked at a variety of veins as part of the study.
Can we make the leap then that MS patients all have stenosis in their veins or blockages in their veins, or do we not know that yet?
Well, these patients were very carefully screened prior to this procedure to see if indeed they had blockages. So after rigorous screening using non-invasive imaging techniques, we believe that they had blockages causing their symptoms, and therefore they were eligible for this safety study. Not all the patients that we actually looked at in the study were found to have lesions, and the data will be coming out soon in peer-reviewed journals. But for the patients that did have these blockages, we've demonstrated, we hope, that this was a very safe procedure.
And it really was. When we say minimally invasive, we were talking about I mean, people think it's a surgery, but it really was just the insertion of a catheter through the groin that went up through the chest, and it searched out basically where this narrowing was.
Precisely. So what we did in this study is utilize the same techniques that we use for stroke treatment, using the blood vessels of the body as highways. And we typically enter these highways in the leg, in the veins and arteries that drain the leg. In this study, because we were interested in looking at veins, what we used were the veins that go to the leg, and use these tubular highways to advance tiny little tubes all the way into those large veins that we just talked about. And once we were there and we noticed the narrowing, then we used the techniques, as Dr. Levy described, that we have utilized for years and made Buffalo really one of the most important places for stroke treatment. We utilize exactly the same techniques to open the veins in the neck.
Your viewers would probably know this from the heart. A lot of your viewers probably had coronary stents, may have had heart attacks, and probably for the past few decades, that's where many of these technologies began, opening blocked vessels of the heart. But through evolution and technological advances, we're able to miniaturize these devices, get them a little bit more flexible, bring them up to the brain, and now we may be, again, I caution, maybe looking at a whole new subset of patients that can be treated with these techniques for MS.
And we should let people know that I had a chance to talk with some of your patients before and after, and they were very comfortable. They weren't even anesthetized, so to speak. I mean, they were numbed, but they were awake through this procedure, which really took maybe just a couple of hours.
That is precisely how it went. The important thing for this first phase study is do no harm. The idea that we'll be able to prove the connection and the link is, I think, premature. But before we engage in these studies, we have to make sure that we are not going to hurt these patients.
Or make them worse.
Or make them worse.
Yeah.
You had the opportunity to really see the cutting edge neurosurgery that happens at Millard Fillmore Gates at UB. It's not just the MS patients. The techniques that you were there watching are the same techniques that we can treat aneurysms, AVMs, other diseases of the brain. When people think of brain surgery now, technology has evolved that sometimes we do actually have to kind of open the hood and take a peek inside and work with open brain surgery. But many, many times we can move devices minimally invasively through a tiny needle in the artery here, all the way from the leg into the brain, while the patient is completely awake, just mildly sedated with some local numbing medicine and some kind of what we call happy juice.
Well, I have to tell you, everybody, it was very crowded outside of that operating room, because there was a lot of people waiting and watching in wonderment, watching the catheters go through the monitors. How you folks work is unbelievable. We should be so proud to have this kind of level of not just surgeons and neurosurgeons, but the fact that we're involved in a study that could be changing so many people's lives. So what we're going to do is we're going to take a break. We know we got a lot of people out there with phone calls. We're going to take your calls and find out now what's next and what we may have learned from first round. We'll find out about the second round too right after this, so stay with us.